All right, let's get right into it. There's this idea that's been floating around for decades, this idea of using super high doses of vitamin C to treat cancer, and honestly, it's been a source of just massive debate and confusion. It's a therapy that's kind of stuck in this medical limbo. Some people swear by its promise, while others dismiss it completely. So the question is, how did a simple vitamin end up at the center of a 40-year-old medical mystery? Well, let's unpack it.
You know, this whole thing really kicked off with a bombshell claim from one of the most brilliant scientists of the 20th century, Linus Pauling. And we're talking about a two-time Nobel laureate here. Back in 1979, he didn't just suggest that vitamin C might help. No, he went way further. He said he hoped it would become an essential part of every single cancer treatment. I mean, that's a huge statement, and it basically set the stage for a controversy that's still raging today.
And this is really the heart of the problem. Pauling himself said we needed properly designed controlled trials to prove what he was seeing. But here we are, more than 40 years later, and guess what? Those big definitive trials, they still haven't been done. And so you have this potentially powerful therapy, one that can't be patented, that's just stuck. Its true potential is still a giant question mark.
Which brings us to the big question we're really digging into here. When you don't have that gold standard proof, what do you do? How are doctors and, more importantly, patients supposed to make these incredibly high-stakes, life-altering decisions? How do you navigate that fog of uncertainty? So let's start by looking at the clues we do have.
So, first things first, how on earth could something as basic as vitamin C possibly fight something as complex as cancer? Well, the answer is actually surprisingly aggressive, and it all comes down to some really fascinating biochemistry. See, at normal doses, vitamin C is an antioxidant. We all know that. But at the super high intravenous doses we're talking about here, it completely flips a switch. It becomes something else entirely. At these incredible concentrations, vitamin C actually becomes a pro-oxidant. It helps create hydrogen peroxide. Yep, the same stuff you have in that brown bottle in your bathroom. This process generates what scientists call reactive oxygen species, or ROS. You can think of them as these tiny, unstable grenades that bounce around inside cells, causing all sorts of damage. And what's so fascinating is how this process seems to single out cancer cells. The flood of these ROS grenades creates an incredibly toxic environment. This oxidative stress just wreaks havoc. It messes with the cancer cell's ability to produce energy, its fuel source, ATP, and it cripples its ability to repair its own DNA. You're basically creating a 5-alarm fire inside the cancer cell that it just can't put out. And this is why the strategy is so clever. You see, cancer cells are already living on a metabolic knife's edge. They have this really delicate internal chemical balance, a redox balance, that they have to maintain just to survive. So flooding them with all this oxidative stress is like targeting their one great vulnerability. It's like finding their Achilles heel and aiming right for it. And listen, this isn't just some fringe idea. This quote comes from James Watson, the guy who co-discovered the double helix structure of DNA. He argued that exploiting these unique metabolic weaknesses is exactly where cancer research needs to go. So the basic theory here isn't just some hopeful whim, it's grounded in some pretty compelling Nobel Prize-winning science. Okay, a really seductive theory is one thing, but a theory is just a theory until you have the data to back it up, right? So what does the evidence actually say? Let's follow the paper trail and see how this whole pro-oxidant idea holds up when you look at the research. And as you can see, there has been a ton of research. I mean, we're talking about more than 70 preclinical lab studies and over 50 clinical trials with actual human patients. And that volume of research creates a real paradox. With all of this study going on, why is there still so little certainty?
Well, this really helps explain why. If you look closely at the kinds of clinical trials that were done, you'll notice something really important. The vast majority of them were phase 1 trials. Now, phase 1 trials are designed to answer one main question: is this treatment safe? They were never designed to find out if it actually works.
So, after all those dozens of studies, the one thing the entire medical community can pretty much agree on is this: high-dose intravenous vitamin C is incredibly safe. It's well-tolerated, has very few side effects, and there's even some good evidence that it can help reduce fatigue and improve a patient's quality of life. But that's where the consensus stops cold. But if you dig into those small trials, you find some really tantalizing hints. Just take a look at this 2014 study on ovarian cancer. When they added high-dose vitamin C to the standard chemo, the median time before the disease got worse jumped by a staggering 8.75 months. In the world of cancer treatment, that is a huge potential difference.
But, and this is the crucial catch, the study only had 25 patients. It was just too small. And in the world of statistics, that means we can't be sure that this incredible result wasn't just random chance. It's a really promising signal for sure, but it's not definitive proof. And that leaves everyone in a really, really tough spot.
And that brings us right to the human side of all this. When the science is promising but unproven, when the data is murky, how do you make a choice? This is the reality for both doctors and patients trying to find their way through this foggy uncertainty.
I love this Yogi Berra quote. It's funny, but it captures a deep truth about medicine. We all want certainty, but we almost never get it. Doctors are constantly forced to make predictions about the future, about how a person will respond to a treatment, using imperfect information.
And this lack of certainty leads to two totally different, but you could argue equally reasonable viewpoints. You've got one camp that says, look, without that big gold standard trial, the evidence is just too weak. We have to dismiss it. And then you have another camp that says, wait a minute, given its incredible safety and the promising science, we should absolutely offer it as a supportive therapy. And the wild thing is, they're both looking at the exact same data.
And really, that is the very essence of the practice of medicine. It's a good reminder that doctors almost never have perfect evidence. The job isn't to wait around forever for flawless data. It's to make the best possible decision for the actual patient sitting right in front of you, using the best available evidence you have today.
So let's try to bring this all together. What do we actually know right now? What are the bottom line facts that a patient and their doctor can use to make an informed decision, based on everything we've just gone over?
Okay, here's the summary. We know for sure that it's safe, but we also know it's a huge commitment. We're talking 5 to 7 hours a week in a clinic, and it's not cheap. It can cost anywhere from $600 to $1,000 a week, out of pocket. It might help with the side effects of chemo and radiation, but the big one, its potential to actually improve outcomes, remains, after 40 years, officially unproven.
And that leaves us right here, with this final critical question. The kind of definitive, large-scale trials that could finally settle this debate once and for all, they're probably still years away. So in the meantime, with a life literally on the line, how do you weigh all the knowns against the unknowns to make the best possible decision for today? Finding an answer to that question, well, that's the very heart of this 40-year medical mystery.